Hi, my name is Mary Ann Tan and I am a third year nursing student studying in UTS. I am here today to discuss about working long hours in the emergency department. This presentation aims to discuss how long working hours or overtime in emergency department impacts patient safety and healthy workplace, discuss current policies, code of ethics, standard of practice that may refer to responsibilities of individual registered nurses and healthcare services. Discuss how effective leadership can support the problem of working long hours in ED. What is working long hours? According to research, it is working time of more than around 40 hours for 7 days or working more than 12 hours a day. There are various reasons for nurses staff to work long hours, including higher remuneration, and nurses may also be obliged to work long hours with the expectation of future promotion. Sometimes, the work arrangement is agreed between the management and nursing staff based on operational needs. Who usually works long hours? Research shows men are most likely to work long hours than women. Men with children are somewhat more likely to work longer hours than those without, while women with children are less likely to work long hours than those without. In addition, there are distinct differences in terms of people age, between 30 and 49 being the most likely to work overtime. According to research, emergency departments are commonly referred as mainly stressful setting with higher numbers and acuity of ED exposures leading to increased pressure and great amount of workloads for staffs. It is vital that emergency nurses to stay alert and awake to deliver safe care to patients. Also, it is crucial that emergency nurses recognize any changes in patient situation, undertake suitable and prompt interventions, and avoid possible risks of errors in medications and procedural orders. However, the 12-hour working shifts by many emergency nurses are considered with having regular overtime, problem in staying awake on duty, lack of sleep times, and considerably risk of error. Research also shows that USA, Australia, and Japan have significantly larger proportions of working long hours than non-English European countries. The problem of working long hour shifts or overtime have become more controversial in contemporary nursing practice, with issues increased over staff performance, high risk of fatigue, and patient safety. Nurses staff working extended shifts or doing overtime shifts or working more than 40 hours a week with lacking sleep of time are most likely at risk of making errors. Negative effects on staff are not only physical and psychological health of individual emergency nurses, but also to the quality of care given to patients. Based on research, impacts of working long hours in ED on nurses are risk of injury to self due to less cognitive function or concentration. Other effects also failure to rescue or help other nurses and reduces staff performance. Working long hours can result to falling asleep while driving home, which can jeopardize other people. There is also a risk of burnout among staff nurses, which can result to leaving the emergency department or the entire nursing profession. Working constant extended hours as well can potentially cause compassion fatigue, which lead the emergency nurse of not having empathy for patients, lack of attentiveness, information processing, and response time that lead to decreased patient satisfaction. According to the study, they considered the risk of burnout and job dissatisfaction were 2.5 times higher for nurses who work longer hours over those who have normal shift of 8 hours. On the other hand, study shows the negative impacts of working long hours on patients. These are risk of errors in medication administration, and when fatigue happens, it reduces the capacity of a nurse to address to patient problems in effective approach with disparity from standards of practice that could negatively impact patient care and procedural failure. By the end of 12-hour shifts, Nurses tend to rush and therefore may be perceived as not providing quality care and perhaps reduce possibility to recommend hospitals to others. Hence, working beyond 8 hours a day adversely impact patient safety. Researchers to fix the issues of working long hours through strategies that are implemented to manage this issue by providing appropriate education and training programs for registered nurses that would help to enhance knowledge and recognition about the negative effects of working long hours. Also, strategies to lower the risk of burnout and fatigue issues. In addition, nurses and managers should discuss the design of work schedules and overtime and offering an option of either 8 or 10-hour of shift. Research also suggested to establish policies and systems that decrease chances for fatigue and other health problems and also promote good fellow workers and supervisor relationships. And lastly, conduct assessments to explore the effects of schedule at work involving the performance, illness, unintended injury, errors, and near misses. According to the policy mandated by Industrial Relations Commission of New South Wales regarding the subject matter of hours of shift, Clause 4, every shift contains of not exceeding 10 hours on a day shift or 11 hours on a night shift, and employees shall not work above 7 consecutive shifts unless employee requests and approved by local nursing management. In addition, based on principle of staffing clause 53, an employee should not be required to work an intractable amount of long hours of work or overtime. Based on Section 1 of Replacement of Absences, when an unintended absence of nurse staff happens, for example due to unforeseen sick leave, the nursing unit manager will directly review the roster shifts to measure the possible effect of the absence on the workload and in terms of overtime of employees. Effective leadership significantly affects on staff satisfaction, commitment, individual and team performance, and organizational culture. Leadership performs a crucial role in mobilizing individuals towards a common goal of the team, attaining excellent health outcomes, and establishing a positive practice environment that draws towards retaining of staffs. It can be resolved or mitigated by addressing the primary cause of overtime and insufficient staffing in the workplace. Also, to make sure that policies are in place to assure enough rest between shifts and managing meal breaks for nurses. According to research, creating a supportive workplace structures and organizational culture that respects nurses' rest day and vacation time, facilitate nurses' prompt leaving after scheduled shift, and allow nurses not to take overtime without being penalized. These policies that promotes manageable work hours for nurses for the betterment of a safe nursing workforce prepared to handle the complex healthcare needs of the patients and families. Moreover, fostering a culture of safety and a sound work environment decreases the risk of possible negative effects associated with fatigue in workplace. Also, maximizing nursing roles to increase patient outcomes and utilizing of all nursing roles should be optimized, thus nurses staff can work to their full scope of practice to enhance patient outcomes, workforce, productivity, and retention, as well as the accessibility and effectiveness of healthcare services. Registered nurses are responsible and accountable to the Nursing Midwifery Board of Australia. Individual registered nurses must obey with policies, legislation, other rules and regulations related to the framework of practice when making decisions. A new code of conduct for nurses has been released by NMBA effective from 1st of March 2018 that primarily involve a section of working long hours. According to Domain, Principle 7, promote health and well-being. Nurses must actively participate in minimizing risk for individuals. Nurses must respect the significant relationship of patient safety and interprofessional capabilities, as well as teamwork, open communication, and great understanding in any cases. Nurses are responsible for the decision making about patients' care, and nurses must ensure to perform the duty within the scope of practice, knowledge, and prevent any circumstances where the capacity to provide best care may be harmed. Nurses should also actively engage in reducing the person's risk. Therefore, nurses play a significant role in recognition and avoidance of negative effects and errors. Nurses are responsible and accountable to make sure the patient's safety all the time and have the ability to practice as a nurse. This covers a continuing self-management and a continuing professional development to be able to enhance, maintain, and extend professional competence, knowledge, and skills to fulfill obligation to deliver the best care, ethical, competence, and safe practice among patients. And also, nurses' responsibility to engage in the development of policies and procedure that promote to a safe, healthy, and efficient work environment. Healthcare organizations are required to commit in improving welfare of the nurses, giving opportunities for support groups, and recommending courses on personal care. Moreover, reinforce work health and safety in a regular briefing and team meetings for staff. In this narrative PowerPoint presentation, graphics inserted to some slide given the audience a greater visual impact for visual learners, and the speech also help auditory learners. The combined multimedia effects provide for intellectual engagement and staff awareness, which are crucial to effective learning. And the terms and languages used in this presentation to discuss the problem encompassing working long hours of nurses in emergency department has been facilitated to provide adequate knowledge for the potential viewers, such as new graduate nurses, senior nurses, nursing students, and other healthcare professionals.